Hi, my name is Sarah Boyle. I'm doing this recording on May 21st, 2026. This is about the disease process that I chose, or the disease, to do a presentation about. I do have a little bit of notes here just to keep me on track. But I did my presentation on hyperlipidemia. Hyperlipidemia is an excess amount of lipids in your blood. That could be your triglycerides, your phospholipids, or your cholesterol levels could be elevated, and that would lead you to a diagnosis of hyperlipidemia. There are 102.2 million Americans who have a cholesterol greater than 200, and 37.7 million of those Americans are at high risk, meaning that their cholesterol level is greater than 240. This is a very important thing that affects so many people in our country. Elevated blood cholesterol levels lead to atherosclerosis, which is plaque buildup inside the arteries. And when you have plaque built up into the arteries, what happens is your artery will have the plaque build up, and it will just keep building up and up and up upon each other, and that will eventually lead to the narrowing of your vessel. So blood's used to going into something like this, and then it gets smaller and smaller and smaller and smaller, which leads to higher amounts of pressure that your body is having to fight against just to get the blood to flow. And that can cause, when you have a total occlusion, it can lead to a heart attack because you're losing that blood flow into one of your main arteries in your heart. It can cause a stroke because the vessels, your main vessels that are leading from your heart to your brain, can become occluded from the plaque buildup. You're at risk even for a piece of the plaque breaking off and going up into your brain somewhere. Also, we see people who have peripheral artery disease, and they're not able to get blood flow down into their extremities because of the narrowing in the vessels, and sometimes it leads to a full occlusion, and that puts you at risk for losing a limb. So it's really important to have and maintain your cholesterol levels at a normal level. So we're thinking about what are elevated blood cholesterol levels. So there's lipoproteins, which are what we're checking, called the cholesterol, and there's 5 different types. So you have your very low density lipoprotein, the VLDL. You have your intermediate density lipoprotein, which is the IDL. You have, a lot of people know this, your low density lipoprotein, which is your LDL level. That's one of the main ones that we're looking at because this is considered your bad cholesterol. So that's the one that's going to lead to the plaque buildup. And then there's high density lipoprotein, which is your HDL, or also deemed your good cholesterol. So your LDL is called your bad cholesterol because your body only has so many different receptors in it that can bind to LDL cholesterol. So once those receptors have been binded, once you've eaten something, that you just have the LDL cholesterol free floating in your blood. Some of the cells, like macrophages and monocytes, will eat the LDL, but if they can't, then it's just an insoluble piece of, in your blood, and that's what's going to build up and lead to the atherosclerosis whenever it can't intake it anymore because you've had an excess amount of it. With your HDL, the good cholesterol, so it has like a reverse effect whenever it comes to transporting cholesterol. It'll actually take it away from your peripheral vessels where it can be stored at, and take it to your liver to be synthesized for energy, whatever your body needs it for. So etiology. So what causes high cholesterol? Which it's multifactorial. Usually it's not just one thing that causes high cholesterol. So, and it can be any of the the lipoproteins could be elevated to be deemed that you have high cholesterol. So it could be your nutrition, which is one of the main factors. So what you're eating, what does your diet look like? It's really, really important. Genetic factors, you could have a familial history and be prone to developing hyperlipidemia. Different medications also can cause hyperlipidemia. You have other comorbid disease processes that make you at higher risk for developing hyperlipidemia. And different metabolic diseases, they can show an increase in your blood lipid levels. So hypercholesterolemia, which is the high cholesterol, which is part of your hyperlipidemia, it can be primary based, which means that you have a genetic condition that makes it, I guess you could say, it's like defectively synthesizes the cholesterol in your blood, or where you can't synthesize it, you don't have enough proteins, or you don't have enough receptors, I guess I should say, to uptake the LDL. So that's secondary, or primary, sorry. And then a secondary cause would be something that's not genetic, something that you're doing to yourself or you're giving yourself. The biggest sign for hyperlipidemia is obesity with high calorie intake and diabetes. And those kind of go hand in hand usually. If you have one, usually you have the other. So when you have a high calorie intake consistently, and you're increasing the production of your VLDL, and it is going to increase your LDL and you'll have high cholesterol. And with the excessive ingestion of cholesterol, then you'll eventually stop or reduce the formation of your LDL receptors, which means that you have less and less receptors to bind to. So even whenever you are maybe eating a healthier diet, you don't have enough receptors that your body once had to digest all of this. So diets that are high in triglycerides and saturated fats are going to increase your cholesterol, will increase your cholesterol synthesis. They'll suppress the LDL receptor activity. Diabetes and a metabolic syndrome can increase your triglycerides, which would decrease your HDL, your good cholesterol, and it can also increase your LDL a little bit. There's also hypothyroidism that can cause high hyperlipidemia, nephrotic syndromes, obstructive liver disease. Medications that can cause it are beta blockers, which a lot of people who already have a heart disease are on it. If you've already suffered from a heart attack or you have high blood pressure, most of the time you're on a beta blocker. That can cause your hyperlipidemia. Different estrogens can. Protease inhibitors, which are used to treat HIV infections, can also increase your chances of having hyperlipidemia. So the way that you get diagnosed is with your blood, doing a blood test. So anyone that's over the age of 20 should have fasting labs done where they do like a lipid panel, and that checks your triglycerides, it checks your total cholesterol, your HDL, your LDL, it checks all that to make sure it's normal or just a follow-up, and that should be done every 5 years. More frequently if you're at a high risk or you already have been diagnosed with it. The way that we treat hyperlipidemia is to decrease the LDL cholesterol in the blood. So that's the primary target, to decrease the therapy. So your major risk factors are if you smoke cigarettes, if you have high blood pressure, if you have a family history of premature heart disease, like in a first-degree relative, mom, dad, men who are, whenever the men are diagnosed with the age of less than 40 or women less than 55. or your HDL cholesterol is low, then you're at a higher risk of developing hyperlipidemia. So depending on whether or not you have other comorbidity factors that I just listed, will determine what they want your level to be at. So if you have no risk factors, you just have high cholesterol, then they want your LDL to be less than 160. If you have 2 or more major risk factors, they want your LDL to be less than 130. If you are at high risk factors, so you have even more risk factors, the LDL needs to be less than 100. And if you're considered very high risk, then LDL less than 70 is the most important thing. The best way that you can manage hyperlipidemia is through your diet and therapeutic lifestyle changes. So physical activity, changing your diet to help decrease your LDL, stop smoking, decrease your weight by improving your diet, and exercising. If you do that for 3 months and you're unsuccessful, they want 3 months of vigorous, rigorous lifestyle changes. And then if you're unsuccessful, then they prescribe you different medications to help control your cholesterol levels. But if you're already at a high risk, they'll start you on the medication. At the same time, they want you to start doing diet changes and exercises to improve your life. So the best dietary changes you can make are decreasing your calorie intake, decreasing saturated and trans fats that you eat, eating more fruits, vegetables, proteins, and having good quality calorie intake. The different types of medications that they prescribe to lower, like lipid lowering drugs, there's the HMG CoA reductase inhibitors. So those are your statin drugs: atorvastatin, rosuvastatin, simvastatin, which is a very common drug nowadays. So that's used to reduce or block the hepatic synthesis of cholesterol to reduce your LDL. So it'll decrease your triglycerides and increase your HDL. There's bile acid binding resins, which are your cholesterol, cholestyramine, cholestyramine, and clovesan. And they bind and sequester cholesterol-containing bile acids in the intestines. All these put together will help improve your chances of overcoming hyperlipidemia. So